Now, Australians are consuming less cocaine and alcohol than last year, while ketamine use is at an all-time high. This is all according to Wastewater analysis revealed this week.
It also found that cannabis was by far the most consumed illicit drug, with its use in regional areas double that in cities. Suzanne Nielsen is the director of the Monash Addiction Research Centre, and she breaks down some of the findings in the report.
Look, we have seen ongoing relatively steady trends over time, but some of those trends you've mentioned, including ongoing high levels of stimulant and cannabis use, do continue.
Ketamine being at an all-time high, what are the reasons behind that?
I think we have to be a little bit careful interpreting these. So it is at an all-time high, but it is also relatively low compared to many other substances. But we do know that some of these patterns are affected by things like price and availability and social context. And we have seen a lot of discussion of things like self-medication for mental health conditions with ketamine. We don't know how much that is driving this use, but it is important for us to understand what's driving it and also try and understand how we can minimise harms for people who might be using it.
Now, while alcohol and nicotine remain the most widely used drugs in the country, it seems Australians are consuming less alcohol. Is that surprising to you?
It's not terribly surprising because we have seen this ongoing trend of reducing alcohol use. There has been a lot of effort around educating around alcohol use, so that's good to see. It is important to remember that with these trends, it is the overall population level. So what we can be missing is that we've seen actually relatively high levels of alcohol use that have stayed high in our older adult populations and a large reduction in youth alcohol use. So that's probably what we're seeing with those declining trends. But we do have some groups of the population where we are still concerned about high levels of alcohol use that can be harmful.
And what about the cannabis use? It's the most consumed illicit drug. Has that been the case for a while now?
It has been the case, but we again need to remember with this data, we cannot tell the difference between illicit cannabis use and cannabis that might be used for medical purposes. And we have seen quite a large increase in the prescribing of cannabis in our communities where people are taking that in a medical context. And some of those products that are being prescribed are very high potency. So that can actually look like a higher amount of cannabis use where it's actually using higher potency products. And again, it's very difficult to disentangle that within the wastewater data. But there is a lot going on with cannabis consumption in our communities in general.
Yeah. What is this data generally used for? How does it help to inform policies and address particularly illicit drug consumption?
So this data is really useful for giving us a high-level picture of overall consumption in the community. It is important to take that data alongside some of our both national data collection around substance use and also some of those very particular studies to understand use in particular populations. Just looking at the data on its own can be hard to interpret, but when we take that with a range of other data sources, it can provide us really important pictures at a national scale in terms of where substance use is going, and particularly where we might need to think about where reducing harm with particular substances is needed because we see use really going up, for example, with ketamine.